Yeah, somatic experiencing was developed by Peter Levine, and it's just an approach to working with trauma that is more kind of looking at the fact that the trauma is more in the body. It's dealing with not just like the midbrain, but even the brain stem. You know, with most psychological issues we're working with, it's like we're thinking more the midbrain, you know, it's like the emotional part, the relational part, what dynamics got from childhood or whatever, you know. But when it comes to like near-death experiences or things that were very intense, it's really fight or flight. And so when that doesn't like resolve itself in a healthy way, it can lead to some symptoms that are very confusing and disturbing, but it also needs to be addressed in a slightly different way. You know, with trauma, it's not that like the event itself is the trauma. I mean, it is, but what is traumatic for one person may not be traumatic for another person or vice versa, but it's more what happens internally. Does the whole nervous system get sort of locked up and frozen around the trauma, or is it kind of moving through it? And somatic experiencing is just an approach to helping people's kind of system approach the feelings and activation in a way that's like it can actually manage. So that's why we do a lot of really going slow and what's called titrating. It's like just taking little pieces at a time. There's something that happens in a healthy nervous system that's natural and is good called pendulation. And it's when there's sort of like a rhythm where we go toward activation, you know, emotion, or we get a little like activated, and then we sort of soothe ourselves and kind of step away from it, maybe look out the window, take a breath, take a break from thinking about that for a second. You know, this is unconscious, but that's like a healthy nervous system. So we can go in therapy, and I'll kind of watch people's nervous systems. It's like when they go toward talking about something hard, does it take little chances for a breath, or is it like where they just get swimming and locked into it? That would be being over here, or being stuck over here where they can't feel it at all and we're just completely avoiding. But therapy is really about finding this nice balance and like wiring that in so you can kind of move toward it, take a little bit of the memory or process and, you know, the feeling, and then kind of come over here and deal with it and process it. So it needs a lot of coaching, especially with anything, but especially with trauma. That's why I'm saying that with the trauma thing, and somatic experiencing really uses that because it is so overwhelming and it messes up the pendulation thing, that it's like we're really coming in and use active skills to help it kind of like come back and really pace the process, teaching grounding, you know, things to help people swing this way, to ground, to soothe, you know, to take a breath, to use the connection for soothing. We call that resourcing, learning how to resource, and then using that for, you know, processing through the trauma. So grounding would be, you know, it's a physical sense of being more in your body. You're being kind of lowered and in yourself. Literally, sometimes people will feel like more rooted to the earth, which is probably why we use the word grounding. And actually, sometimes getting your feet on the floor and pushing against the floor can be a grounding kind of force. But it's like the opposite of dissociating. It's like when people feel like they're kind of floating up, they're a little bit like spinning or out of their body. And then certainly if there's like dissociation, then grounding would be what you would want to do. You know, it's like, okay, come back into like feeling your body so that you're more centered in your whole, again, more centered in your whole brain, everything's active, and more centered in your kind of base and feeling like you can slow down, make sense of it, organize it, rather than sort of be lost and spinning in it.